The first symptoms of Parkinson's disease are mild and are becoming increasingly noticeable with the passage of time. The typical initial picture registers pain in the joints, difficulties to make movements and exhaustion. The calligraphy also begins to change and become small and irregular. In 80% of patients, symptoms begin on only one side of the body and then become generalized. Also, the character varies in the early stages, so it is usual irritability or depression without apparent cause. All these symptoms can last a long time before the classic signs that confirm the development of the disease are manifested. The typical symptoms are the following. Tremor, it consists of a rhythmic movement backwards and forwards. It usually begins in the hand, although sometimes it affects first a foot or the jaw. It is exacerbated at rest or under tense situations and tends to disappear during sleep. It can affect only one side or one part of the body. Rigidity, it manifests as a resistance or lack of muscular flexibility. All muscles have an opposite muscle, and movement is possible because, when a muscle is activated, the opposite relaxes. When this balance is broken, the muscles tense and contract, causing inflexibility and weakness. Bradykinesia, it is the loss of spontaneous and automatic movement and leads to slowness in all actions. This slowness is unpredictable and is the most disabling symptom, because the patient cannot quickly perform habitual movements that were previously almost mechanical. Instability, the instability of the position causes the patients to lean forward or backward and fall easily. The head and shoulders fall forward and the gait gets worse. The patient takes short and quick steps to maintain balance, or is literally planted halfway, unable to move. There are a series of secondary symptoms that, although they do not affect all the patients, cause important disorders since they worsen the main symptoms and aggravate the physical and psychological conditions of the patient. Depression, it is a problem common to all chronic diseases, and in Parkinson's disease it can be detected even before the main symptoms begin. It worsens with the drugs used to combat this pathology, although antidepressants are able to successfully stop both depressions and emotional changes. The FEEN estimates that 40% of patients with Parkinson's have depression. Difficulty swallowing and chewing, the malfunction of the muscles makes this daily task difficult, favoring the accumulation of saliva and food in the oral cavity. As a consequence, choking and drooling are common. Diction, at least 50% of sufferers have diction problems. They speak in a low voice, hesitate before speaking, repeat words, or speak too quickly. Urinary problems, the deficiencies of the nervous system that regulates muscle activity cause some patients to suffer incontinence or have difficulty urinating. If you want more information about Parkinson, I invite you to my channel and I will share my story. Thank you for watching this video.